Question 1. A nurse is preparing to administer medications to a client with dysphagia. Which actions should the nurse take to ensure safe medication administration? Select all that apply. A. Crush all tablets and mix them with applesauce. B. Place the client in a semi-Fowler's position before administering. C. Ensure the client is fully awake and alert. D. Provide liquids for the client to swallow with medications. E. Administer medications one at a time. F. Check for a gag reflex if the client has a history of aspiration. Answer. Ensure the client is fully awake and alert. Provide liquids for the client to swallow with medications. Administer medications one at a time. Check for a gag reflex if the client has a history of aspiration. This question tests knowledge of safe medication administration for clients with dysphagia, which means difficulty swallowing. The most important clues are dysphagia and safe medication administration. Ensuring the client is awake, providing appropriate liquids, administering one medication at a time, and assessing gag reflex are all crucial steps to prevent aspiration. Crushing all tablets is not always safe, e.g., enteric-coated, extended release, and a semi-Fowler's position is inadequate. A high Fowler's is preferred to minimize aspiration risk. For example, before giving a pill to an elderly client who struggles with swallowing, a nurse would first confirm alertness and then offer the pill with a sip of water, one at a time. Always prioritize patient safety by assessing swallowing ability and adapting medication delivery as needed. Question 2. The nurse is caring for a client newly diagnosed with type 2 diabetes mellitus. Which teachings are essential for this client regarding lifestyle modifications? Select all that apply. A. Limit carbohydrate intake to less than 50 grams per day. B. Engage in at least 150 minutes of moderate-intensity aerobic activity per week. C. Monitor blood glucose levels daily. D. Prioritize lean protein sources and healthy fats. E. Restrict fluid intake to prevent fluid overload. F. Avoid all sugar-containing foods. Answer. Engage in at least 150 minutes of moderate-intensity aerobic activity per week, monitor blood glucose levels daily, prioritize lean protein sources and healthy fats. This question focuses on essential lifestyle modifications for a client with newly diagnosed type 2 diabetes mellitus. Key clues are type 2 diabetes and lifestyle modifications. Regular moderate exercise, daily blood glucose monitoring, and a balanced diet emphasizing lean proteins and healthy fats are foundational for managing blood sugar and overall health. Limiting carbohydrates excessively, restricting fluids, or completely avoiding all sugar-containing foods are often too extreme or incorrect advice, as a balanced approach is key, and some sugar in moderation might be acceptable within a controlled diet. For instance, recommending a brisk 30-minute walk 5 times a week and eating grilled chicken with vegetables helps manage blood sugar. Remember that a balanced and sustainable approach is crucial for long-term diabetes management. Question 3. A client is receiving intravenous potassium chloride. Which assessment findings require immediate intervention by the nurse? Select all that apply. A. Serum potassium level of 3, 8 milliequivalent/L. B. ECG showing peak T waves. C. Muscle weakness and lethargy. D. Urine output of 60 milliliters per hour. E. Hypotension and bradycardia. F. Client reports pain at the foresite. Answer. ECG showing peak T waves, muscle weakness and lethargy, hypotension and bradycardia. This question addresses the critical assessment findings indicating complications of intravenous potassium chloride, specifically hyperkalemia. The key phrase is immediate intervention, signaling a need to identify life-threatening symptoms. Peak T waves on an ECG, muscle weakness, lethargy, hypotension, and bradycardia are all classic signs of hyperkalemia, which can be life-threatening and requires prompt action. A serum potassium of 3.8 milliequivalent/L is within the normal range, urine output of 60 milliliters per hour is adequate, and foresight pain, while needing attention, is not as immediately life-threatening as the other options. For example, if a client receiving 4 potassium suddenly develops an irregular pulse and feels extremely weak, the nurse must stop the infusion and notify the provider immediately. Always recognize that cardiac changes and severe neurological symptoms are red flags for electrolyte imbalances. Question 4. The nurse is educating a client with a new colostomy. Which instructions should the nurse include in the teaching plan? Select all that apply. A. Empty the ostomy pouch when it is 1/3 to 1/2 full. B. Change the ostomy appliance daily to prevent skin irritation. C. Avoid foods that cause gas or odor, such as cabbage and beans. D. Clean the stoma and surrounding skin with mild soap and water. E. Monitor the stoma for a pink or red, moist appearance. F. Contact the healthcare provider if the stoma appears dusky or blue. Answer. Empty the ostomy pouch when it is 1/3 to 1/2 full. Avoid foods that cause gas or odor, such as cabbage and beans. Clean the stoma and surrounding skin with mild soap and water. Monitor the stoma for a pink or red, moist appearance. Contact the healthcare provider if the stoma appears dusky or blue. This question focuses on essential education for a client with a new colostomy, emphasizing proper care and potential complications. The crucial clues are new colostomy and teaching plan. Proper pouch emptying, avoiding gas-producing foods, gentle skin care, monitoring for a healthy stoma appearance, pink/red and moist, and knowing when to report concerning changes, dusky/blue stoma indicating compromised blood flow, are all vital for client self-management and preventing complications. Changing the appliance daily is too frequent and can cause skin irritation. Instead, it should be changed every 3 to 7 days or as needed. For example, teaching a client to empty their pouch when it's about 1/3 full prevents the weight from pulling on the skin barrier. Remember to teach both routine care and warning signs for prompt intervention. Question 5. The nurse is assessing a client for signs of fluid volume deficit. Which findings would the nurse expect to observe? Select all that apply. A. Bounding peripheral pulses. B. Increased urine-specific gravity. C. Dry mucous membranes. D. Flat neck veins. E. Hypotension. F. Weight gain. Answer. Increased urine-specific gravity, dry mucous membranes, flat neck veins, hypotension. This question assesses the nurse's ability to identify clinical manifestations of fluid volume deficit, or dehydration. The core concept is fluid volume deficit. Key expected findings include increased urine-specific gravity due to concentrated urine, dry mucous membranes, flat neck veins, indicating decreased intravascular volume, and hypotension, low blood pressure. Bounding peripheral pulses and weight gain are typically associated with fluid volume excess, not deficit. For instance, a client with significant vomiting and diarrhea would likely show these signs of dehydration. It's important to link these physical findings to the underlying physiological changes to recognize fluid balance issues. Question 6. The nurse is preparing to administer an intramuscular, IM, injection. Which actions are appropriate? Select all that apply. A. Choose a 25 gauge, 5/8 inch needle for an adult in the deltoid. B. Wear clean gloves during the procedure. C. Aspirate for blood return after needle insertion. D. Inject medication slowly to minimize discomfort. E. Massage the site vigorously after injection. F. Select the ventrogluteal site for infants. Answer. Wear clean gloves during the procedure, aspirate for blood return after needle insertion, inject medication slowly to minimize discomfort. This question focuses on safe and appropriate practices for administering an intramuscular, IM, injection. The critical clue is IM injection. Wearing clean gloves maintains aseptic technique, aspirating for blood return confirms the needle is not in a blood vessel. Though current evidence suggests this step is not always necessary for all vaccines, it is still a common practice taught for IM injections generally, and injecting slowly minimizes discomfort and allows tissue absorption. A 25 gauge, 5/8 inch needle is typically too short for an adult IM injection in the deltoid, usually 1 to 5 inches. Massaging the site after injection is generally avoided as it can push medication into subcutaneous tissue or irritate the muscle. The ventrogluteal site is appropriate for adults and children, but for infants, the vastus lateralis is usually preferred due to better muscle development. For example, when giving an antibiotic IM, a nurse would don gloves, insert the needle, pull back slightly on the plunger to check for blood, and then push the medication in slowly. Always prioritize patient safety, comfort, and proper technique for IM injections. Question 7. A client with a new prescription for Warfarin is receiving discharge teaching. Which statements indicate that the client understands the teaching? Select all that apply. A. I should avoid eating green leafy vegetables. B. I will need regular blood tests to check my INR. C. I should use a soft bristle toothbrush. D. I will take aspirin if I have a headache. E. I should report any unusual bleeding or bruising. F. I can stop taking this medication once my blood clot dissolves. Answer. I will need regular blood tests to check my INR. I should use a soft bristle toothbrush. I should report any unusual bleeding or bruising. This question assesses a client's understanding of warfarin therapy, a critical anticoagulant medication. The keywords are warfarin and understands the teaching, indicating a need to identify correct statements about medication management. Regular INR monitoring, using a soft bristle toothbrush to prevent gum bleeding, and reporting unusual bleeding or bruising are all correct and vital instructions for safe warfarin use. Avoiding all green leafy vegetables is incorrect, rather, maintaining consistent intake is key, as they contain vitamin K, which affects warfarin. Taking aspirin is contraindicated due to increased bleeding risk, and stopping warfarin without a provider's order is dangerous, even if the clot has dissolved, as warfarin is often long-term therapy. For instance, a client should understand that if they cut themselves shaving, the bleeding might be prolonged, and they should apply pressure. Remember that patient education for anticoagulants focuses heavily on safety and adherence to prevent complications. Question 8. The nurse is assessing a client for signs of acute delirium. Which characteristics are commonly associated with delirium? Select all that apply. A. Gradual onset over months to years. B. Fluctuation in level of consciousness throughout the day. C. Disorientation to time and place. D. Impaired attention span. E. Irreversible cognitive decline. F. Hallucinations and delusions. Answer. Fluctuation in level of consciousness throughout the day, disorientation to time and place, impaired attention span, hallucinations and delusions. This question tests the nurse's ability to recognize the key characteristics of acute delirium. The term acute delirium is the primary clue, distinguishing it from other cognitive impairments. Delirium is characterized by a sudden or acute onset, fluctuating levels of consciousness, disorientation, impaired attention span, and often perceptual disturbances like hallucinations or delusions. It is typically reversible if the underlying cause is treated. Gradual onset and irreversible decline are more characteristic of dementia. For example, an elderly client recovering from surgery who suddenly becomes confused, agitated, and believes spiders are crawling on the ceiling is likely experiencing delirium. Remember that delirium is an acute change in mental status that often fluctuates and requires immediate investigation into its cause. Question 9. The nurse is preparing to insert a peripheral intravenous IV catheter. Which actions demonstrate appropriate technique? Select all that apply. A. Apply a tourniquet 6 to 8 inches above the chosen insertion site. B. Cleanse the insertion site with an antiseptic solution using a back and forth motion for 15 seconds. C. Select the largest possible gauge catheter to ensure rapid fluid administration. D. Anchor the vein below the insertion site by pulling the skin taut. E. Insert the catheter at a 10 to 15 degree angle with the bevel up. F. Advance the catheter until a flashback of blood is observed. Answer. Apply a tourniquet 6 to 8 inches above the chosen insertion site. Cleanse the insertion site with an antiseptic solution using a back and forth motion for 15 seconds. Anchor the vein below the insertion site by pulling the skin taut. Insert the catheter at a 10 to 15 degree angle with the bevel up. This question evaluates the nurse's knowledge of proper peripheral IV catheter insertion technique. The crucial clue is appropriate technique for IV insertion. Applying a tourniquet correctly, thorough antiseptic cleansing, often using a back and forth or friction scrub motion for a specified duration, anchoring the vein, and inserting the catheter at a shallow angle with the bevel up are all standard, correct practices. Selecting the largest possible gauge is not always appropriate. The smallest effective gauge should be chosen based on the client's needs and vein size to minimize trauma. While flashback indicates entry into the vein, the catheter should then be advanced slightly further to ensure the tip is fully in the lumen before the stylet is withdrawn, not just advanced until flashback. For example, when inserting in IV, after finding a good vein, the nurse would clean the area thoroughly, stabilize the vein, and insert the needle at a shallow angle. Mastering IV insertion requires careful attention to each step to ensure patient safety and success. Question 10. A nurse is providing discharge teaching for a client with heart failure. Which instructions should be included? Select all that apply. A. Report a weight gain of 3 pounds in 1 day or 5 pounds in 1 week. B. Restrict sodium intake to 2 grams per day or less. C. Elevate legs when sitting to promote venous return. D. Limit fluid intake to 1.5-2 liters per day as prescribed. E. Increase physical activity immediately upon discharge. F. Take diuretics only when experiencing shortness of breath. Answer. Report a weight gain of 3 pounds in 1 day or 5 pounds in 1 week. Restrict sodium intake to 2 grams per day or less. Elevate legs when sitting to promote venous return. Limit fluid intake to 1.5-2 liters per day as prescribed. This question focuses on essential discharge teaching for a client with heart failure. The keywords heart failure and discharge teaching indicate the need to identify crucial self-management strategies. Monitoring for sudden weight gain, adhering to sodium restrictions, elevating legs to reduce edema, and following prescribed fluid restrictions are all vital for managing heart failure symptoms and preventing exacerbations. Increasing physical activity immediately or taking diuretics only when symptomatic is incorrect. Activity should be gradually increased as tolerated, and diuretics should be taken as prescribed, often daily, regardless of immediate symptoms. For example, a client with heart failure should weigh themselves every morning and call their doctor if their weight suddenly increases, as this can indicate fluid retention. Empower clients to actively participate in their care by recognizing and responding to early signs of worsening heart failure. Question 11. The nurse is caring for a client in skeletal traction. Which actions are appropriate for the nurse to take? Select all that apply. A. Remove the weights if the client reports severe pain. B. Ensure the weights hang freely and do not touch the floor. C. Turn the client every 2 hours while maintaining alignment. D. Perform neurovascular checks on the affected extremity every 4 hours. E. Provide pin site care as prescribed, looking for signs of infection. F. Elevate the head of the bed to 90 degrees for comfort. Answer. Ensure the weights hang freely and do not touch the floor. Turn the client every 2 hours while maintaining alignment. Perform neurovascular checks on the affected extremity every 4 hours. Provide pin site care as prescribed, looking for signs of infection. This question assesses the nurse's understanding of appropriate care for a client in skeletal traction. The key phrase is skeletal traction, which implies maintaining continuous pull and preventing complications. Ensuring weights hang freely, turning the client while maintaining alignment, performing regular neurovascular checks, and providing pin site care to prevent infection are all essential interventions for client safety and comfort. Removing weights without an order can disrupt the traction and cause harm, and elevating the head of the bed to 90 degrees can alter the line of pull and may be contraindicated depending on the type of traction. For example, a nurse would observe the weights carefully to make sure they are not resting on the bed or floor, which would reduce the effectiveness of the traction. Always prioritize maintaining the prescribed traction setup and vigilant monitoring for complications. Question 12. A nurse is assessing a client with suspected deep vein thrombosis, DVT. Which findings are consistent with DVT? Select all that apply. A. Unilateral leg swelling. B. Warmth and redness in the affected leg. C. Positive Holman's sign. D. Absent peripheral pulses. E. Calf pain or tenderness. F. Coolness and pallor of the affected extremity. Answer. Unilateral leg swelling, warmth and redness in the affected leg, calf pain or tenderness. This question tests the nurse's ability to identify the classic signs and symptoms of deep vein thrombosis, DVT. The crucial clue is suspected deep vein thrombosis. Unilateral leg swelling, warmth, redness, and calf pain or tenderness are common indicators of DVT, caused by inflammation and impaired venous return. A positive Holman's sign, pain in the calf upon dorsiflexion of the foot, is no longer a reliable diagnostic sign and can be dangerous to elicit due to the risk of dislodging a clot. Absent peripheral pulses, coolness, and pallor are more indicative of arterial insufficiency, not venous thrombosis. For instance, if a client complains of one leg being larger and more painful than the other, especially after prolonged immobility, DVT should be suspected. Always remember that DVT typically presents with signs of inflammation and impaired venous drainage in one limb. Question 13. The nurse is preparing to administer packed red blood cells to a client. Which actions are essential before starting the transfusion? Select all that apply. A. Ensure the client has an 18-gauge or larger 4 catheter. B. Verify the client's identity with another licensed nurse. C. Warm the blood product to body temperature. D. Check the expiration date of the blood product. E. Obtain baseline vital signs. F. Administer pre-medication as ordered, e.g., diphenhydramine, acetaminophen. Answer. Verify the client's identity with another licensed nurse. Check the expiration date of the blood product. Obtain baseline vital signs. Administer pre-medication as ordered, e.g., diphenhydramine, acetaminophen. This question focuses on the critical safety steps required before initiating a packed red blood cell transfusion. The primary clue is essential before starting the transfusion. Verifying client identity with another licensed nurse, checking the blood product's expiration date, obtaining baseline vital signs, and administering any prescribed pre-medications are all crucial for patient safety and preventing transfusion reactions. While a larger 4-gauge, e.g., 18 to 20 gauge, is preferred for rapid infusion, a 20 gauge or even a 22 gauge might be used if necessary, so 18 gauge or larger isn't strictly universally essential. Warming the blood product is typically done only if rapid transfusion of large volumes is needed, not as a routine practice, as it carries risks. For example, 2 nurses would cross-check the blood bag label against the client's identification bracelet and medical record to ensure the correct blood is given to the correct patient. Always prioritize rigorous checks to prevent life-threatening errors during blood transfusions. Question 14. A client is experiencing an acute asthma exacerbation. Which assessment findings indicate a worsening condition? Select all that apply. A. Increased wheezing. B. Paradoxical breathing. C. Use of accessory muscles for breathing. D. Respiratory rate of 12 breaths/min. E. Peak expiratory flow rate, PEFR, less than 50% of personal best. F. Speaking in full sentences. Answer. Increased wheezing, paradoxical breathing, use of accessory muscles for breathing, peak expiratory flow rate, PEFR, less than 50% of personal best. This question tests the nurse's ability to recognize signs of a worsening acute asthma exacerbation. The critical clues are acute asthma exacerbation and worsening condition. Increased wheezing, paradoxical breathing, chest and abdomen move opposite during inspiration, use of accessory muscles, and a significantly decreased peak expiratory flow rate, PEFR, are all indicative of increasing respiratory distress and airway obstruction. A respiratory rate of 12 breaths/min is within the normal range and does not indicate worsening asthma, which typically causes tachypnea. Speaking in full sentences suggests less respiratory distress. The inability to speak more than a few words is a sign of severe distress. For example, if an asthmatic client suddenly starts gasping for air and their chest appears to sink in with each breath, it signals a severe exacerbation requiring immediate intervention. Always be vigilant for signs of respiratory compromise, as asthma can quickly escalate. Question 15. The nurse is providing education on fall prevention for an older adult client. Which recommendations should the nurse include? Select all that apply. A. Keep pathways clear of clutter and throw rugs. B. Wear loose-fitting, comfortable shoes. C. Install grab bars in the bathroom. D. Ensure adequate lighting in all areas of the home. E. Get up quickly from a sitting or lying position. F. Participate in regular strength and balance exercises. Answer. Keep pathways clear of clutter and throw rugs. Install grab bars in the bathroom. Ensure adequate lighting in all areas of the home. Participate in regular strength and balance exercises. This question focuses on crucial fall prevention strategies for older adults. The key clue is fall prevention for an older adult. Removing clutter and throw rugs, installing grab bars, ensuring good lighting, and engaging in strength and balance exercises are all effective measures to reduce fall risk. Wearing loose-fitting shoes can actually increase the risk of tripping. Well-fitting, supportive shoes are better. Getting up quickly from a sitting or lying position can cause orthostatic hypotension, leading to dizziness and falls, so rising slowly is recommended. For example, suggesting a client remove a small rug from the living room floor and install a grab bar near their toilet can significantly enhance home safety. Encourage clients to modify their environment and lifestyle to proactively prevent falls. Question 16. A client is receiving total parenteral nutrition, TPN. Which nursing interventions are appropriate for this client? Select all that apply. A. Change the TPN bag and tubing every 48 hours. B. Monitor blood glucose levels every 6 hours. C. Administer 4 fluids through the same lumen as the TPN. D. Monitor for signs of infection at the central line insertion site. E. Begin TPN administration at full prescribed rate. F. Weigh the client daily. Answer. Monitor blood glucose levels every 6 hours. Monitor for signs of infection at the central line insertion site. Weigh the client daily. This question addresses the essential nursing interventions for a client receiving total parenteral nutrition, TPN. The keyword total parenteral nutrition, TPN, indicates the need for careful monitoring and infection prevention. Monitoring blood glucose every 6 hours is crucial due to the high dextrose content. Monitoring for central line infection is paramount, and daily weights assess fluid balance and nutritional status. TPN bags and tubing should be changed every 24 hours, not 48. Other 4 fluids should not be administered through the same lumen as TPN to prevent contamination and ensure accurate delivery. TPN should be initiated gradually and tapered off to allow the pancreas to adjust to glucose load, not started at the full rate. For example, a nurse would check a client's blood sugar levels frequently to prevent hyperglycemia and would closely inspect the 4 site for any redness or swelling. Always prioritize meticulous care and close monitoring for clients receiving TPN due to the high risk of complications. Question 17. The nurse is assessing a client with suspected opioid overdose. Which clinical manifestations should the nurse anticipate? Select all that apply. A. Pinpoint pupils. B. Bradypnea. C. Tachycardia. D. Hypotension. E. Hyperthermia. F. Decreased level of consciousness. Answer. Pinpoint pupils, bradypnea, hypotension, decreased level of consciousness. This question tests the nurse's ability to recognize the classic signs of an opioid overdose. The critical clue is opioid overdose. Opioids typically cause central nervous system depression, leading to pinpoint pupils, slow and shallow breathing, bradypnea, hypotension, and a decreased level of consciousness, which can progress to coma. Tachycardia and hyperthermia are generally not associated with opioid overdose. Bradycardia and hypothermia are more likely. For example, a client found unresponsive with tiny pupils and very slow breathing would immediately raise suspicion for opioid overdose, requiring naloxone administration. Remember that pinpoint pupils, respiratory depression, and decreased LOC are the classic triad for opioid toxicity. Question 18. The nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. Which actions are appropriate for the nurse to include in the plan of care? Select all that apply. A. Irrigate the NG tube with 30 milliliters of normal saline every 4 hours. B. Maintain the client in a supine position to prevent tube displacement. C. Monitor the client's electrolyte balance. D. Provide frequent oral hygiene. E. Assess bowel sounds every shift. F. Clamp the NG tube during ambulation. Answer. Irrigate the NG tube with 30 milliliters of normal saline every 4 hours, monitor the client's electrolyte balance, provide frequent oral hygiene, assess bowel sounds every shift. This question focuses on appropriate nursing care for a client with a nasogastric NG tube for gastric decompression. The key phrase is NG tube for gastric decompression. Irrigating the tube prevents clogs. Monitoring electrolytes is crucial due to fluid loss. Frequent oral hygiene addresses discomfort from dry mouth, and assessing bowel sounds helps determine when the decompression might no longer be needed. The client should be maintained in a semi-Fowler's position to prevent aspiration, not supine. Clamping the NG tube during ambulation is generally contraindicated as it defeats the purpose of decompression unless specifically ordered for a procedure. For example, a nurse would regularly flush the NG tube with saline to ensure it drains properly and would check for signs of electrolyte imbalance, like muscle weakness. Always prioritize tube patency, comfort, and monitoring for complications related to fluid and electrolyte balance. Question 19. The nurse is educating a client about manifestations of hypoglycemia. Which signs and symptoms should the nurse instruct the client to watch for? Select all that apply. A. Shakiness and tremors. B. Excessive thirst and frequent urination. C. Sweating and pallor. D. Mental confusion or difficulty concentrating. E. Fruity breath odor. F. Headache and irritability. Answer. Shakiness and tremors, sweating and pallor, mental confusion or difficulty concentrating, headache and irritability. This question tests the nurse's knowledge of the common signs and symptoms of hypoglycemia, or low blood sugar. The core concept is manifestations of hypoglycemia. Shakiness, tremors, sweating, pallor, mental confusion, difficulty concentrating, headache, and irritability are all classic adrenergic and neuroglycopenic symptoms of hypoglycemia. Excessive thirst, frequent urination, and fruity breath odor are characteristic of hyperglycemia, high blood sugar, not hypoglycemia. For example, a client who suddenly feels nervous, starts sweating, and has trouble thinking clearly should immediately check their blood sugar. Remind clients that feeling shaky and sweaty often signals low blood sugar and requires immediate action. Question 20. A client is prescribed a clear liquid diet. Which food items are appropriate for the nurse to offer? Select all that apply. A. Plain gelatin. B. Cream of mushroom soup. C. Apple juice. D. Broth. E. Milk. F. Tea with sugar. Answer. Plain gelatin, apple juice, broth, tea with sugar. This question assesses the nurse's understanding of a clear liquid diet. The key clue is clear liquid diet, which means foods that are liquid at room temperature and through which one can see. Plain gelatin, apple juice, without pulp, broth, and tea, with or without sugar, are all appropriate clear liquids. Cream of mushroom soup and milk are opaque and contain dairy, making them inappropriate for a clear liquid diet. For example, a client preparing for surgery might be offered clear broth and gelatin for dinner the night before. Always remember, if you can see through it and it's liquid at body temperature, it's likely a clear liquid. Question 21. The nurse is assessing a client for increased intracranial pressure, ICP. Which findings should the nurse anticipate? Select all that apply. A. Bradypnea. B. Tachycardia. C. Papilledema. D. Projectile vomiting. E. Hypertension with widening pulse pressure. F. Hyperthermia. Answer: papilledema, projectile vomiting, hypertension with widening pulse pressure, hyperthermia. This question focuses on recognizing the classic signs and symptoms of increased intracranial pressure, ICP. The crucial clue is increased intracranial pressure. Papilledema, swelling of the optic disc. C. Projectile vomiting, without nausea, hypertension with a widening pulse pressure, Cushing's triad, and hyperthermia are all indicators of rising ICP. Bradypnea, slow breathing, and bradycardia are also part of Cushing's triad and usually present with severe ICP, not tachycardia. For example, a client who sustained a head injury might develop a severe headache, start vomiting without warning, and have an elevated blood pressure with a significant difference between systolic and diastolic numbers. Always be vigilant for these neurological changes, as increased ICP can rapidly lead to brain damage or herniation. Question 22. A client is receiving continuous bladder irrigation after a transurethral resection of the prostate, TURP. Which findings require the nurse's immediate attention? Select all that apply. A. Bright red urinary drainage with clots. B. Client reports bladder spasms. C. Urine output is less than irrigation fluid infused. D. Client reports pain 4/10. E. Clear, straw-colored urinary drainage. F. Disconnected tubing at the catheter port. Answer: bright red urinary drainage with clots, urine output is less than irrigation fluid infused, disconnected tubing at the catheter port. This question assesses the nurse's ability to identify critical complications in a client receiving continuous bladder irrigation post-TURP. The keywords are continuous bladder irrigation, TURP, and immediate attention. Bright red drainage with clots indicates active bleeding, requiring irrigation adjustment or provider notification. Urine output less than irrigation fluid infused suggests a potential blockage or accumulation within the bladder, which can lead to distension and pain. A disconnected tubing compromises the sterile system and could cause infection or hemorrhage if pressure is lost. Bladder spasms are common but can be managed with medication and are not usually an immediate life-threatening concern. Pain at 4/10 is moderate and should be addressed but is not as urgent as the other issues. Clear, straw-colored drainage is the desired outcome, not a concern. For instance, if the client's urine drainage suddenly turns dark red with large clots, the nurse must increase the irrigation rate and notify the provider immediately. Prioritize findings that indicate hemorrhage, obstruction, or infection. Question 23. The nurse is teaching a client about self-care for peripheral arterial disease, PAD. Which instructions should the nurse include? Select all that apply. A. Elevate legs above the heart to reduce swelling. B. Inspect feet daily for any signs of injury or infection. C. Wear clean, loose-fitting cotton socks. D. Apply a heating pad to painful extremities for comfort. E. Avoid crossing legs at the knees or ankles. F. Walk for 30 minutes daily to the point of slight discomfort. Answer: inspect feet daily for any signs of injury or infection, wear clean, loose-fitting cotton socks, avoid crossing legs at the knees or ankles, walk for 30 minutes daily to the point of slight discomfort. This question focuses on essential self-care education for a client with peripheral arterial disease, PAD. The key phrase is peripheral arterial disease, which involves compromised arterial blood flow to the extremities. Daily foot inspection, wearing protective and comfortable socks, avoiding leg crossing, which further restricts blood flow, and engaging in a supervised walking program, walking to the point of discomfort, then resting, are all crucial for improving circulation and preventing complications. Elevating legs above the heart can actually worsen arterial blood flow, and applying direct heat can cause burns due to decreased sensation and poor circulation, so both are contraindicated. For example, a client should be encouraged to take short walks, resting whenever leg pain, claudication, starts, then resuming. Emphasize consistent foot care and activities that promote circulation while avoiding constrictive habits. Question 24. A nurse is preparing to administer medications via a gastrostomy tube. Which actions are appropriate? Select all that apply. A. Crush all medications into a fine powder before mixing with water. B. Check for gastric residual volume before administration. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Administer all medications together simultaneously. E. Keep the head of the bed elevated to 30 to 45 degrees during and after administration. F. Avoid administering medications that are extended release or enteric coated. Answer. Check for gastric residual volume before administration. Flush the tube with 15 to 30 milliliters of water before and after each medication. Keep the head of the bed elevated to 30 to 45 degrees during and after administration. Avoid administering medications that are extended release or enteric coated. This question addresses the safe and effective administration of medications via a gastrostomy tube. The critical clue is administer medications via a gastrostomy tube. Checking gastric residual volume prevents overfilling the stomach, flushing the tube prevents clogging, elevating the head of the bed minimizes aspiration risk, and avoiding extended release or enteric coated medications is crucial because crushing them alters their intended release mechanism. Not all medications can be crushed, some cannot be crushed or administered through a tube. Administering all medications simultaneously can lead to interactions or poor absorption. Medications should be given separately, flushing between each. For example, before giving medications, a nurse would check how much liquid is in the stomach and then administer each medication individually, followed by a water flush. Always prioritize patient safety and medication integrity when administering drugs through enteral tubes. Question 25. The nurse is assessing a client with Cushing's syndrome. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Moon face and buffalo hump. B. Hypertension. C. Weight loss. D. Hypoglycemia. E. Purple striae on the abdomen. F. Hypernatremia and hypokalemia. Answer. Moon face and buffalo hump, hypertension, purple striae on the abdomen, hypernatremia and hypokalemia. This question tests the nurse's ability to recognize the characteristic signs and symptoms of Cushing's syndrome, which results from excessive cortisol. The key phrase is Cushing's syndrome. Expected findings include moon face, round face, buffalo hump, fat pad between shoulders, hypertension, thin skin with purple striae, stretch marks, hypernatremia, high sodium, and hypokalemia, low potassium. Weight gain, not weight loss, is typical due to fluid retention and fat redistribution. Hyperglycemia, not hypoglycemia, is common due to cortisol's effect on glucose metabolism. For example, a client with Cushing's might exhibit a rounded face, high blood pressure, and distinctive reddish-purple stretch marks on their belly. Remember that Cushing's syndrome often involves a distinctive body habitus and electrolyte imbalances. Question 26. A client with a new diagnosis of glaucoma is receiving education from the nurse. Which statements indicate effective client understanding? Select all that apply. A. I will need to use my eye drops for the rest of my life. B. This condition causes sudden, severe eye pain. C. I should avoid bending over or straining during bowel movements. D. My peripheral vision might already be damaged. E. Regular follow-up appointments are important to monitor my eye pressure. F. I can stop using my eye drops if my vision improves. Answer. I will need to use my eye drops for the rest of my life. My peripheral vision might already be damaged. Regular follow-up appointments are important to monitor my eye pressure. This question assesses the client's understanding of glaucoma management. The key phrases are glaucoma and effective client understanding. Glaucoma is a chronic condition requiring lifelong eye drop use to manage intraocular pressure, and peripheral vision is often the first to be affected. Regular follow-up is critical to monitor progression. Glaucoma typically causes gradual, painless vision loss. Sudden, severe eye pain is more characteristic of acute angle closure glaucoma, a specific type, or other eye conditions. Avoiding bending and straining can be helpful to prevent transient increases in intraocular pressure, but this is not always universally stressed as a primary intervention for all types of glaucoma, and other options are more central. Eye drops should never be stopped without a healthcare provider's order, even if vision seems improved, as the damage is often irreversible. For example, a client should understand that even if they feel fine, consistent eye drop use is like taking blood pressure medication to prevent further damage. Stress the importance of adherence and ongoing monitoring for this sight-threatening condition. Question 27. The nurse is caring for a client with a full-thickness burn. Which interventions are appropriate for the nurse to perform? Select all that apply. A. Administer intravenous opioids for pain management. B. Apply ice packs directly to the burned area. C. Cover the burn with a dry, sterile dressing. D. Monitor for signs of fluid volume deficit. E. Administer a tetanus prophylaxis as ordered. F. Encourage a high-protein, high-calorie diet. Answer. Administer intravenous opioids for pain management, cover the burn with a dry, sterile dressing, monitor for signs of fluid volume deficit, administer a tetanus prophylaxis as ordered, encourage a high-protein, high-calorie diet. This question focuses on appropriate nursing interventions for a client with a full-thickness burn. The critical clue is full-thickness burn. Administering 4 opioids for severe pain, covering the burn with a dry sterile dressing to protect it, monitoring for fluid volume deficit, due to massive fluid shifts, administering tetanus prophylaxis, due to skin barrier disruption, and providing a high-protein, high-calorie diet for wound healing are all crucial. Applying ice packs directly to the burn can cause vasoconstriction and further tissue damage and should be avoided. For instance, a nurse would ensure the client's pain is well controlled with 4 medication, keep the wound covered to prevent infection, and encourage nutrient-rich meals to aid recovery. Prioritize pain management, infection prevention, and nutritional support in burn care. Question 28. A client is receiving a continuous enteral feeding via a nasoenteric tube. Which actions should the nurse perform? Select all that apply. A. Check gastric residual volume every 4 hours. B. Elevate the head of the bed to at least 30 to 45 degrees. C. Dilute the formula with water if it is too thick. D. Flush the tube with water every 8 hours or as prescribed. E. Change the feeding bag and tubing every 24 hours. EF. Administer medications through a separate port if available. Answer. Check gastric residual volume every 4 hours. Elevate the head of the bed to at least 30 to 45 degrees. Flush the tube with water every 8 hours or as prescribed. Change the feeding bag and tubing every 24 hours. Administer medications through a separate port if available. This question assesses appropriate nursing interventions for a client receiving continuous enteral feeding. The key phrase is continuous enteral feeding via a nasoenteric tube. Checking gastric residual volume, elevating the head of the bed to prevent aspiration, flushing the tube to maintain patency, changing the feeding bag and tubing regularly to prevent bacterial growth, and using separate ports for medications are all essential safety and maintenance practices. Diluting the formula is not appropriate unless specifically ordered by the provider, as it can alter the nutritional content and electrolyte balance. For example, a nurse would ensure the client remains upright during feeding and would routinely flush the tube to prevent it from becoming clogged. Emphasize preventing aspiration, maintaining tube patency, and reducing infection risk. Question 29. The nurse is preparing a client for discharge following a myocardial infarction, MI. Which instructions are essential for the nurse to include? Select all that apply. A. Limit physical activity for the next 6 months. B. Report chest pain that is unrelieved by rest or nitroglycerin. C. Maintain a low-fat, low-sodium diet. D. Take aspirin daily as prescribed. E. Avoid all sexual activity indefinitely. F. Participate in a cardiac rehabilitation program. Answer. Report chest pain that is unrelieved by rest or nitroglycerin, maintain a low-fat, low-sodium diet, take aspirin daily as prescribed, participate in a cardiac rehabilitation program. This question focuses on critical discharge instructions for a client recovering from a myocardial infarction, MI. The keywords myocardial infarction and discharge instructions guide the selection of interventions for preventing future cardiac events. Reporting unrelieved chest pain, adhering to a heart-healthy diet, taking prescribed medications like aspirin, and participating in cardiac rehabilitation are all vital for recovery and secondary prevention. While activity should be gradually increased, limiting it for 6 months is excessive. Clients are typically encouraged to resume activity under supervision. Avoiding all sexual activity indefinitely is incorrect. Often, clients can resume sexual activity once they can walk 2 flights of stairs or briskly walk a block without symptoms. For example, a client should be taught to call 911 if their chest pain doesn't go away after taking nitroglycerin, or if it changes in severity. Empower clients to actively manage their cardiac health through education and support. Question 30. A nurse is assessing a client with diverticulitis during an acute exacerbation. Which findings should the nurse expect? Select all that apply. A. Right lower quadrant pain. B. Fever and chills. C. Nausea and vomiting. D. Constipation or diarrhea. E. Rigid, board-like abdomen. F. Elevated white blood cell count. Answer. Fever and chills, nausea and vomiting, constipation or diarrhea, elevated white blood cell count. This question tests the nurse's ability to recognize the clinical manifestations of acute diverticulitis. The key phrase is diverticulitis during an acute exacerbation. Expected findings include fever and chills, indicating infection/inflammation, nausea and vomiting, changes in bowel habits, constipation or diarrhea, and an elevated white blood cell count. Pain is typically in the left lower quadrant, not the right. A rigid, Board-like abdomen is a sign of peritonitis, which is a severe complication, not a typical expected finding of diverticulitis itself, although it can occur if perforation happens. For instance, a client might come to the emergency department with abdominal pain in their lower left side, a low-grade fever, and feel sick to their stomach. Always consider infection and inflammation when assessing for diverticulitis exacerbations. Question 31. The nurse is providing care for a client with a new tracheostomy. Which interventions are appropriate for the nurse to perform? Select all that apply. A. Deflate the cuff during meals to prevent aspiration. B. Perform tracheostomy care every 4 hours or as needed. C. Keep 2 fingers loosely under the thighs to prevent skin breakdown. D. Monitor for signs of respiratory distress. E. Maintain a bedside call light within reach. F. Provide humidified air to prevent mucus plugs. Answer. Perform tracheostomy care every 4 hours or as needed, monitor for signs of respiratory distress, maintain a bedside call light within reach, provide humidified air to prevent mucus plugs. This question addresses appropriate nursing interventions for a client with a new tracheostomy. The critical clue is new tracheostomy. Regular tracheostomy care, vigilant monitoring for respiratory distress, ensuring the call light is accessible, as the client cannot speak, and providing humidified air to prevent mucus plugs are all essential for client safety and comfort. The cuff should not be routinely deflated during meals. If a cuff is present, it is often inflated to prevent aspiration, or specific protocols for cuff deflation with suctioning should be followed. The ties should be snug, allowing only 1 finger to pass underneath, not 2, to ensure tube security. For example, a nurse would frequently suction the tracheostomy, ensure the room air is moist, and confirm the client can easily signal for help. Always prioritize airway patency, infection prevention, and communication for clients with a tracheostomy. Question 32. The nurse is assessing a client with early signs of sepsis. Which findings are indicative of early sepsis? Select all that apply. A. Hypotension. B. Bradypnea. C. Tachycardia. D. Fever or hypothermia. E. Mental status changes. F. Warm, flushed skin. Answer. Tachycardia, fever or hypothermia, mental status changes, warm, flushed skin. This question tests the nurse's ability to recognize the early clinical manifestations of sepsis. The key phrase is early signs of sepsis. Early sepsis often presents with tachycardia, fever, or sometimes hypothermia, subtle mental status changes, and warm, flushed skin, indicating vasodilation. Hypotension is a sign of septic shock, a later and more severe stage. Bradypnea, slow breathing, is not typical. Tachypnea, rapid breathing, is more common as the body tries to compensate. For instance, a client with a urinary tract infection who suddenly develops a fever, feels confused, and has a rapid heart rate might be developing sepsis. Early recognition and intervention are critical for improving outcomes in sepsis. Question 33. The nurse is caring for a client with Clostridium difficile infection, C. diff. Which infection control measures are appropriate? Select all that apply. A. Place the client in a private room. B. Wear a N95 respirator mask when entering the room. C. Perform hand hygiene with an alcohol-based hand rub. D. Wear a gown and gloves for all client contact. E. Clean surfaces with a bleach-based solution. F. Use dedicated equipment for the client. Answer. Place the client in a private room, wear a gown and gloves for all client contact, clean surfaces with a bleach-based solution, use dedicated equipment for the client. This question focuses on appropriate infection control measures for a client with Clostridium difficile, C. difficile, infection. The critical clue is Clostridium difficile infection. Placing the client in a private room, wearing a gown and gloves for all client contact precautions, using a bleach-based solution for environmental cleaning, as C. diff spores are resistant to many disinfectants, and using dedicated equipment are all essential to prevent transmission. Hand hygiene must be performed with soap and water, not alcohol-based hand rub, because alcohol is ineffective against C. diff spores. An N95 mask is for airborne precautions, not necessary for C. diff. For example, after caring for a client with C. diff, a nurse must wash their hands thoroughly with soap and water for at least 20 seconds. Always remember that C. diff requires specific contact precautions and thorough hand washing with soap and water. Question 34. A nurse is administering a subcutaneous injection. Which actions are appropriate? Select all that apply. A. Administer at a 90-degree angle if the client is obese. B. Pinch the skin at the injection site. C. Select a 25-gauge, 5/8-inch needle. D. Aspirate for blood return before injecting medication. E. Administer the medication rapidly. F. Rotate injection sites to prevent tissue damage. Answer. Administer at a 90-degree angle if the client is obese. Pinch the skin at the injection site, select a 25-gauge, 5/8-inch needle, rotate injection sites to prevent tissue damage. This question assesses proper technique for administering a subcutaneous injection. The core concept is subcutaneous injection. Administering at a 90-degree angle for obese clients, or 45 degrees for average build, pinching the skin, unless using a short needle on a thin client, using a 25-gauge, 5/8-inch needle, and rotating sites are all correct practices for subcutaneous injections. Aspiration for blood return is generally not recommended for subcutaneous injections, especially for insulin or heparin, as it can cause hematoma formation. Rapid injection can increase discomfort and pain. Medication should be administered slowly. For instance, when giving insulin, a nurse would pinch a fold of skin on the abdomen, insert the needle, and inject the medication slowly, then choose a different spot for the next dose. Always prioritize proper angle, site selection, and rotation for subcutaneous injections. Question 35. The nurse is providing education to a client prescribed digoxin. Which instructions should the nurse include? Select all that apply. A. Take your pulse for 1 full minute before taking this medication. B. Hold the medication if your heart rate is below 80 beats per minute. C. Report any yellow or green halos around lights. D. Increase your intake of potassium-rich foods. E. This medication helps to lower your blood pressure. F. Recognize signs of toxicity such as nausea, vomiting, or diarrhea. Answer. Take your pulse for 1 full minute before taking this medication. Report any yellow or green halos around lights. Recognize signs of toxicity such as nausea, vomiting, or diarrhea. This question focuses on essential client education for digoxin, a cardiac glycoside. The keyword digoxin cues the nurse to consider its narrow therapeutic range and potential for toxicity. Instructing the client to take their apical pulse for a full minute before administration and to report visual disturbances, like halos, a sign of toxicity, or gastrointestinal symptoms, also signs of toxicity, are crucial for safe use. The medication should be held if the heart rate is below 60 beats per minute, not 80. Increasing potassium intake is generally done only if the client is hypokalemic, as hypokalemia can increase the risk of digoxin toxicity, but it's not a universal recommendation for all clients. Digoxin primarily strengthens cardiac contractions and slows the heart rate. It doesn't primarily lower blood pressure. For example, a client taking digoxin should know to call their doctor if they feel very nauseous or see strange colors. Emphasize diligent pulse monitoring and recognizing early signs of toxicity. Question 36. A nurse is assessing a client with a suspected ruptured appendix. Which clinical manifestations should the nurse expect? Select all that apply. A. Generalized abdominal pain that shifts to the right lower quadrant. B. Rebound tenderness at McBurney's point. C. Diarrhea. D. Low-grade fever. E. Increased appetite. F. Nausea and vomiting. Answer. Generalized abdominal pain that shifts to the right lower quadrant, rebound tenderness at McBurney's point, low-grade fever, nausea and vomiting. This question tests the nurse's ability to recognize the classic signs and symptoms of a ruptured appendix. The critical clue is ruptured appendix, implying a severe inflammatory process that has progressed. Expected findings include abdominal pain that starts generalized and then localizes to the right lower quadrant, McBurney's point, rebound tenderness, pain upon release of pressure, a low-grade fever, and nausea/vomiting. Diarrhea is less common than constipation or absent bowel movements. An increased appetite is highly unlikely given the pain and nausea. For instance, a client who initially feels sick to their stomach and has diffuse abdominal pain, but then feels sharp pain specifically when the nurse releases pressure from their lower right abdomen, should be immediately evaluated for appendicitis. Always remember that worsening abdominal pain, especially localized and with rebound tenderness, is a key indicator of appendicitis. Question 37. The nurse is preparing to administer medications to a client with a history of liver disease. Which considerations are essential for the nurse to make? Select all that apply. A. Administer all medications orally to ensure first-pass metabolism. B. Monitor for signs of increased bleeding due to impaired clotting factor synthesis. C. Anticipate reduced dosages of medications metabolized by the liver. D. Assess for drug-induced encephalopathy. E. Administer medications at the highest therapeutic dose to ensure efficacy. F. Prioritize medications that are primarily excreted by the kidneys. Answer. Monitor for signs of increased bleeding due to impaired clotting factor synthesis, anticipate reduced dosages of medications metabolized by the liver, assess for drug-induced encephalopathy, prioritize medications that are primarily excreted by the kidneys. This question focuses on crucial considerations when administering medications to a client with liver disease. The keywords are liver disease and medication administration. Clients with liver disease have impaired drug metabolism and synthesis of clotting factors, so monitoring for bleeding, anticipating reduced dosages of liver-metabolized drugs, assessing for drug-induced encephalopathy due to toxin accumulation, and prioritizing kidney-excreted drugs are all essential for safety. Administering all medications orally might be problematic due to impaired first-pass metabolism, and medications should generally not be given at the highest therapeutic dose but rather adjusted to the client's liver function. For example, if a client with cirrhosis needs pain medication, the nurse might expect a lower dose of a drug like acetaminophen and would monitor for confusion or changes in bleeding. Always remember that the liver plays a vital role in drug metabolism, and dysfunction requires careful medication adjustment to prevent toxicity. Question 38. The nurse is educating a client about measures to prevent urinary tract infections, UTIs. Which instructions should the nurse include? Select all that apply. A. Drink at least 8 to 10 glasses of water daily. B. Wipe from back to front after urination. C. Void after sexual intercourse. D. Wear tight-fitting underwear. E. Avoid taking showers, baths are preferred. F. Urinate frequently, and do not hold urine. Answer. Drink at least 8 to 10 glasses of water daily, void after sexual intercourse, urinate frequently, and do not hold urine. This question focuses on essential education for preventing urinary tract infections, UTIs. The core concept is prevent urinary tract infections. Drinking plenty of fluids, voiding after sexual intercourse, and urinating frequently help flush bacteria from the urinary tract. Wiping from back to front can introduce bacteria from the anus into the urethra. Wiping front to back is correct. Wearing tight-fitting underwear can create a warm, moist environment conducive to bacterial growth. Cotton, loose-fitting underwear is preferred. Baths are generally not preferred over showers as they can increase bacterial exposure to the urethra. For example, a nurse would teach a client to drink plenty of water throughout the day and to always go to the bathroom as soon as they feel the urge, rather than waiting. Emphasize hygiene and frequent emptying of the bladder to reduce UTI risk. Question 39. The nurse is assessing a client with a suspected ruptured ectopic pregnancy. Which findings should the nurse expect? Select all that apply. A. Unilateral, stabbing abdominal pain. B. Heavy vaginal bleeding with clots. C. Referred shoulder pain. D. Signs of hypovolemic shock. E. Amenorrhea. F. Lower abdominal fullness. Answer. Unilateral, stabbing abdominal pain, referred shoulder pain, signs of hypovolemic shock, amenorrhea. This question tests the nurse's ability to recognize the critical signs and symptoms of a ruptured ectopic pregnancy, a life-threatening obstetric emergency. The critical clue is ruptured ectopic pregnancy. Expected findings include unilateral, stabbing abdominal pain, referred shoulder pain, due to diaphragmatic irritation from internal bleeding, signs of hypovolemic shock, e.g., hypotension, tachycardia, pallor, due to hemorrhage, and amenorrhea, missed period. Heavy vaginal bleeding with clots is more indicative of a miscarriage, while ectopic pregnancies typically present with spotting or no bleeding. Lower abdominal fullness is a general symptom and not specific enough for a ruptured ectopic pregnancy. For instance, a woman who missed her period and then experiences sudden, severe one-sided abdominal pain and feels dizzy should be immediately evaluated for a ruptured ectopic pregnancy. Recognize that referred shoulder pain and signs of shock are particularly concerning for internal hemorrhage. Question 40. A client is prescribed furosemide. Which assessment findings indicate the medication is having its intended effect? Select all that apply. A. Decreased urine output. B. Weight loss. C. Improved breath sounds, clearer. D. Increased blood pressure. E. Decreased peripheral edema. F. Elevated serum potassium level. Answer. Weight loss, improved breath sounds, clearer, decreased peripheral edema. This question assesses the nurse's understanding of the therapeutic effects of furosemide, a loop diuretic. The key phrases are furosemide and intended effect. Furosemide helps the body excrete excess fluid, so expected therapeutic outcomes include weight loss, improved breath sounds, as pulmonary edema resolves, and decreased peripheral edema. Decreased urine output would indicate the medication is not working or is causing complications. Increased blood pressure is not an intended effect. Furosemide often lowers blood pressure due to fluid removal. Furosemide can lead to decreased serum potassium, not elevated, due to its mechanism of action. For example, a client with heart failure taking furosemide would show signs of fluid reduction, such as less swelling in their ankles and easier breathing. Always connect medication actions to expected physiological changes to evaluate effectiveness. Question 41. The nurse is caring for a client with hyperthyroidism. Which clinical manifestations should the nurse expect to find? Select all that apply. A. Bradycardia. B. Weight loss despite increased appetite. C. Exophthalmos. D. Heat intolerance. E. Constipation. F. Fine tremors. Answer. Weight loss despite increased appetite, exophthalmos, heat intolerance, fine tremors. This question tests the nurse's ability to recognize the characteristic signs and symptoms of hyperthyroidism, a condition of excessive thyroid hormone production. The core concept is hyperthyroidism. Expected findings include weight loss despite increased appetite, due to increased metabolism, exophthalmos, bulging eyes, heat intolerance, and fine tremors. Tachycardia, not bradycardia, is typical. Diarrhea, not constipation, is common due to increased GI motility. For example, a client with hyperthyroidism might complain of feeling constantly hot, losing weight without trying, and having shaky hands. Remember that hyperthyroidism accelerates the body's metabolism, leading to symptoms of overactivity. Question 42. A nurse is preparing to administer an oral medication to a client. Which steps are crucial to ensure safe medication administration? Select all that apply. A. Administer the medication within 15 minutes of the scheduled time. B. Verify the client's identity using two identifiers. C. Check for allergies before administration. D. Crush all tablets to facilitate swallowing. E. Document the medication administration after completing all client care. F. Provide patient education about the medication. Answer. Verify the client's identity using two identifiers, check for allergies before administration, provide patient education about the medication. This question focuses on crucial steps for safe oral medication administration. The key phrase is crucial to ensure safe medication administration. Verifying client identity with two identifiers, checking for allergies, and providing patient education are all fundamental rights and responsibilities of medication administration. While administering medications on time is important, a 15-minute window is often used for routine medications, but the most critical steps relate to safety. Crushing all tablets is inappropriate, as many medications, e.g., extended release, and enteric-coated, cannot be crushed. Documentation should occur immediately after administration, not after completing all client care, to ensure accuracy. For example, before giving a client their blood pressure pill, the nurse would confirm their name and birth date, ask about any allergies, and briefly explain what the medication is for. Always adhere to the rights of medication administration to prevent errors. Question 43. The nurse is caring for a client with an acute exacerbation of ulcerative colitis. Which assessment findings should the nurse expect? Select all that apply. A. Bloody diarrhea. B. Weight gain. C. Abdominal cramping and pain. D. Low-grade fever. E. Increased appetite. F. Anemia. Answer. Bloody diarrhea, abdominal cramping and pain, low-grade fever, anemia. This question assesses the nurse's ability to recognize the clinical manifestations of an acute exacerbation of ulcerative colitis. The key phrase is acute exacerbation of ulcerative colitis. Expected findings include bloody diarrhea, a hallmark symptom, abdominal cramping and pain, low-grade fever, indicating inflammation, and anemia due to chronic blood loss. Weight loss, not weight gain, is common due to malabsorption, diarrhea, and decreased appetite. Decreased appetite, not increased, is typical during an exacerbation. For example, a client experiencing a flare-up might report frequent, urgent urges to use the bathroom, passing stools mixed with blood and mucus, and feeling fatigued. Always associate ulcerative colitis exacerbations with significant gastrointestinal distress and systemic symptoms. Question 44. A client is suspected of having a urinary tract infection, UTI. Which laboratory findings would support this diagnosis? Select all that apply. A. Presence of ketones in urine. B. Positive leukocyte esterase. C. Presence of nitrites in urine. D. Urine pH of 5.0. E. Presence of bacteria in urine. If. Specific gravity of 1.010. Answer. Positive leukocyte esterase, presence of nitrites in urine, presence of bacteria in urine. This question focuses on laboratory findings indicative of a urinary tract infection, UTI. The key clue is urinary tract infection. A positive leukocyte esterase, indicating white blood cells, presence of nitrites, byproduct of bacterial metabolism, and presence of bacteria in the urine are all strong indicators of a UTI. Ketones in urine can indicate diabetic ketoacidosis or starvation, not typically UTI. A urine pH of 5.0 is acidic and within a normal range, not necessarily indicative of UTI, though some bacteria can alter pH. A specific gravity of 1.010 is within the normal range for urine, indicating adequate hydration, not a UTI. For example, a urine dipstick showing positive for leukocyte esterase and nitrites, followed by a culture growing E. coli, confirms a UTI. Remember that a combination of these findings provides a clear picture of a UTI. Question 45. The nurse is providing discharge teaching for a client with newly diagnosed hypertension. Which lifestyle modifications should the nurse emphasize? Select all that apply. A. Reduce sodium intake to less than 1,500 mg per day. B. Engage in brisk walking for at least 30 minutes, most days of the week. C. Limit alcohol consumption to no more than 1 drink per day for women and 2 for men. D. Increase potassium intake through foods like bananas and potatoes. E. Avoid all forms of caffeine. If. Stop smoking and avoid secondhand smoke. Answer. Reduce sodium intake to less than 1,500 mg per day, engage in brisk walking for at least 30 minutes, most days of the week, limit alcohol consumption to no more than 1 drink per day for women and 2 for men, increase potassium intake through foods like bananas and potatoes, stop smoking and avoid secondhand smoke. This question focuses on essential lifestyle modifications for a client with newly diagnosed hypertension. The keywords hypertension and lifestyle modifications emphasize non-pharmacological interventions. Reducing sodium, regular aerobic exercise, limiting alcohol, increasing potassium intake, unless contraindicated by kidney disease, and smoking cessation are all crucial recommendations for managing blood pressure. Avoiding all caffeine is often not necessary. Moderate caffeine intake may be acceptable for some individuals, though it can cause a temporary increase in blood pressure. For example, A nurse would advise a client to choose fresh fruits and vegetables over processed foods to reduce sodium and increase potassium. Empower clients to make these changes to effectively manage their blood pressure. Question 46. A nurse is assessing a client for manifestations of fluid volume excess. Which findings would the nurse expect to observe? Select all that apply. A. Decreased blood pressure. B. Distended neck veins. C. Crackles in the lungs. D. Increased heart rate. E. Weight gain. F. Oliguria. Answer. Distended neck veins, crackles in the lungs, weight gain, increased heart rate. This question assesses the nurse's ability to identify clinical manifestations of fluid volume excess or overhydration. The core concept is fluid volume excess. Expected findings include distended neck veins, crackles in the lungs, pulmonary edema, weight gain, and an increased heart rate as the heart works harder. Increased blood pressure is also common, not decreased. Oliguria, decreased urine output, is usually associated with fluid volume deficit or kidney issues, not excess. For example, a client with congestive heart failure who has gained several pounds over a few days and reports difficulty breathing while lying flat is likely experiencing fluid volume excess. Always link these physical findings to the underlying physiological changes of too much fluid in the body. Question 47. The nurse is caring for a client who is NPO and receiving 4 fluids. Which interventions are appropriate for the nurse to implement? Select all that apply. A. Provide frequent oral hygiene. B. Offer ice chips every hour. C. Assess for signs of fluid overload. D. Monitor intravenous site for infiltration. E. Clamp the 4 line if the client complains of thirst. F. Provide education on the importance of the NPO status. Answer. Provide frequent oral hygiene, assess for signs of fluid overload, monitor intravenous site for infiltration, provide education on the importance of the NPO status. This question focuses on appropriate nursing interventions for a client who is NPO, nothing by mouth, and receiving 4 fluids. The keywords are NPO and 4 fluids. Providing frequent oral hygiene alleviates dry mouth. Assessing for fluid overload is crucial with 4 fluids. Monitoring the 4 site for complications like infiltration is essential, and educating the client on their NPO status helps ensure adherence. Offering ice chips is contraindicated for NPO status unless specifically permitted by the provider for certain conditions, e.g., prior to a colonoscopy, but not generally for surgery. Clamping the 4 line without an order is inappropriate and could cause complications or disrupt fluid balance. For example, a nurse would regularly clean the client's mouth with a moist sponge and explain why they cannot have anything to eat or drink before their surgery. Always prioritize comfort, safety, and client education for NPO clients with 4 fluids. Question 48. A client is experiencing an allergic reaction to a medication. Which clinical manifestations should the nurse expect? Select all that apply. A. Urticaria. B. Hypotension. C. Bradycardia. D. Stridor. E. Wheezing. F. Decreased respiratory rate. Answer. Urticaria, hypotension, stridor, wheezing. This question tests the nurse's ability to recognize the common clinical manifestations of an allergic reaction, which can range from mild to life-threatening. The critical clue is allergic reaction. Urticaria, hives, hypotension, due to vasodilation, stridor, high-pitched inspiratory sound indicating upper airway obstruction, and wheezing, whistling sound indicating lower airway obstruction, are all signs of an allergic response. Tachycardia, not bradycardia, is more common due to the body's compensatory mechanisms, and an increased respiratory rate is typical, not decreased. For example, a client who develops widespread hives, swollen lips, and difficulty breathing after receiving a new antibiotic is having an allergic reaction. Prompt recognition of these signs is essential for immediate intervention to prevent anaphylaxis. Question 49. The nurse is caring for a client with a C. diff infection. Which actions are appropriate when providing care? Select all that apply. A. Place the client in a private room or cohort with another C. diff client. B. Instruct visitors to wear gowns and gloves. C. Perform hand hygiene with soap and water after removing gloves. D. Use alcohol-based hand sanitizer instead of soap and water if hands are not visibly soiled. E. Administer oral vancomycin as prescribed. F. Disinfect stethoscopes and blood pressure cuffs before and after use. Answer. Place the client in a private room or cohort with another C. diff client, instruct visitors to wear gowns and gloves, perform hand hygiene with soap and water after removing gloves, administer oral vancomycin as prescribed, disinfect stethoscopes and blood pressure cuffs before and after use. This question addresses specific care considerations for a client with Clostridium difficile, C. diff, infection. The keywords are C. diff infection and appropriate actions. Placing the client in a private room, or cohorting, ensuring visitors wear gowns and gloves, performing hand hygiene with soap and water, as alcohol-based sanitizers are ineffective against C. diff spores, administering prescribed oral vancomycin, a common treatment, and disinfecting equipment are all essential to prevent transmission and treat the infection. Using alcohol-based hand sanitizer instead of soap and water is incorrect for C. diff. For example, a nurse would ensure meticulous hand hygiene with soap and water after caring for the client and would instruct family members on proper glove and gown use before entering the room. Adherence to strict contact precautions and proper hand hygiene is paramount for C. diff. Question 50. The nurse is assessing a client for effective postoperative pain management. Which findings indicate the client's pain is adequately controlled? Select all that apply. A. Client rates pain as 7/10 after medication. B. Client is restless and unable to sleep. C. Client is able to ambulate to the bathroom with minimal discomfort. D. Client maintains stable vital signs within their baseline. E. Client frequently requests PRN pain medication before the scheduled interval. F. Client is able to participate in deep breathing and coughing exercises. Answer. Client is able to ambulate to the bathroom with minimal discomfort. Client maintains stable vital signs within their baseline. Client is able to participate in deep breathing and coughing exercises. This question tests the nurse's ability to identify indicators of effective postoperative pain management. The core concept is effective postoperative pain management. The ability to ambulate with minimal discomfort, stable vital signs within baseline, and participation in therapeutic exercises, like deep breathing and coughing, all suggest that pain is adequately controlled. A pain rating of 7 out of 10, restlessness, inability to sleep, and frequent requests for PRN medication before the interval all indicate inadequate pain control. For example, a client who can comfortably turn in bed, take deep breaths without wincing, and walk to the chair shows good pain control. Always consider both subjective reports and objective functional indicators when evaluating pain management.